Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. Dissect and Connect is a service of New River Valley Community Services and the Montgomery County Prevention Partners. Beth O'Connor has had the privilege of living and working in rural areas most of her life. Raised in Minnesota, she received her bachelor's degree at a small liberal arts college and went on to earn her master's degree in health promotion and education from the University of Cincinnati. She's had the opportunity to work at a camp for persons with disabilities, a county health department, and a small town transit service. Since 2005, Beth has served as executive director of the Virginia Rural Health Association. Well, hey, Beth, welcome to the Dissect and Connect podcast.
Thank you for having me.
Such a pleasure to speak with you. Glad to have you on the show. So, for our listeners who are not familiar with the Virginia Rural Health Association, I was hoping that maybe you could take a few minutes to talk to us about the organization, your mission, and some of your key programs.
Sure. So the Virginia Rural Health Association is a nonprofit advocacy organization. We've got about 1,500 members statewide, including NRVCS as a member. And with that, we essentially provide three services to our members. One is education. We have conference and webinars and other educational events throughout the year. We're going to be having, of course, our virtual conference this fall. Very excited to be able to push that out very soon, let people know what's going on there. We provide information. We have a weekly electronic newsletter that goes out to our membership, plus Facebook, Twitter, all the other social media type things. And of course, our own podcast, The Rural Health Voice, which I encourage people to check out. And I appreciate you being a guest on that podcast very recently. And then the last thing is advocacy. I spend part of my time talking to our elected officials about how the decisions they make affect health and healthcare in rural Virginia.
All right, there we go. We will definitely include a link to your podcast and the VRHA website in our show notes for today's episode. So right. You talked about healthcare. What are the primary issues for rural Virginians?
Well, for rural Virginia and rural America in general, access is a big thing. There's been a lot of discussions in the last 10, 15 years about who can afford insurance and who can't. But a big part of the issue in rural America is even if you have insurance, that doesn't mean that there's a doctor to go to. Mm-hmm. We have a much smaller percentage of physicians per population than in our urban and suburban areas. And as far as specialists goes, those are very, very difficult to find in rural Virginia. Pretty much any job title that ends in ologist does not exist in rural America. And so that's a major focus for us. But, we look at a lot of other things. One is, the hospital closure crisis that we've seen in rural America in the last 10 years. Virginia, of course, has lost two hospitals, the Lee County Hospital and the Patrick Hospital. And efforts are underway to try to reopen those. But that's a very difficult thing to do once a facility closes. So we're seeing what we can do to help that process.
So what does it mean when we lose hospitals? What does that ultimately, how does that ultimately impact our communities?
Sure. It's on several levels. So one, you have the actual physical closing the building, which means you lose a healthcare access point. So if someone, say, has a heart attack and they need to have an emergency room trip, and that emergency room is now an hour and a half away instead of 15 minutes away, obviously that's a major problem for folks that need that immediate access to healthcare. But there's also a lot of, bigger picture issues. So, not only do you not have that emergency care, but if you don't have that hospital facility, it also means there's not support for other clinics and other healthcare outlets in the community. And so it's not at all unusual that if a hospital closes, so do the surrounding small clinics, because they don't have places to refer patients to. Maybe there's not an employer because they were employed by the hospital, but also had their own private clinic. It's not even remotely unusual for an entire healthcare system in a community to dry up and move away. But then you've also got the economic issues. There's a lot of talk in rural economic development communities about needing to attract employers. Well, a hospital is a big employer. It employs a lot of people, and it employs people that get big salaries.
Mm-hmm.
Doctors don't come cheap. Anesthesiologists don't come cheap. Good nurses do not come cheap. And the salaries and therefore the tax base that goes with having the facility when you close the hospital, they also leave. But you also have the extended service. A hospital is not just healthcare. There's also sanitation. There's also housekeeping. There's also food services. All of those connected services go away. So the economic impact of losing a hospital for a community is tremendous.
Mm-hmm. Well, just speaking from personal experience, I had a reason to be in our local ER here back in the fall with my wife. And we got to spend several hours, I'll say, in the waiting area. And I was surprised to hear just, in conversations in the room about how far people were traveling to get to this particular facility. I mean, it really kind of blew my mind to hear how far people had to travel to get to this one hospital.
Absolutely. Yeah, when you think about, you hear big headlines about the RAM clinics that they have in some of the rural communities. People travel to Southwest Virginia from Ohio, further afield than that, just to be able to get access to a free clinic that only exists for 2 days. It's incredible.
So what's the key issue there? Why are these hospitals closing?
Well, there's a lot of things. And then there's really no one thing. There's a whole compilation of little things. But over the years, our healthcare system for our rural hospitals has really been eroded. Congressional cuts have taken, a little bit here and a little bit there. There's a 1%, cut from revenue in this area and a 2% cut in revenue from that area. And for a big suburban hospital, 1% here, 2% there is not that big of a deal.
Mm-hmm.
But for our rural hospitals, that can easily be the difference between open and closed. And on top of that, you have the issue that our rural facilities are more likely to have a vast majority of their population on Medicare and Medicaid, which is not pay as much as private insurance. So again, those little 1-2% cuts are even more. Plus, it's not unusual for a rural hospital to have 10 or even 15% of their customers not have traditional type of insurance. Either people who maybe they don't work, so they don't have insurance, or they're self-employed, maybe a farmer or a small business owner that doesn't have their own insurance. And so when it comes to showing up in the hospital emergency room, they don't have a ready way to pay. And, you think about if you went to the grocery store or a clothing store or apartment complex and say, I need food or clothing or shelter, but you don't have a way to pay, oh, well.
Right.
But for a hospital, they are federally required to provide service to you, whether you can pay for it or not. And so for hospitals to try to keep their doors open in that environment is very difficult.
And admittedly, a lot of the folks that live in these communities, we're talking about people who are affected by generational poverty.
Yes.
True?
Absolutely.
And there is a myriad of issues that come along with that as well.
Yes. Yeah. One of the things that we look at on the national level is our rural communities, on average, they don't make as much money. On average, they are more likely to be over 65. On average, they're more likely to have, not just a complex medical issue, but maybe 5 or 6 of them. It's not just that they have COPD or just that they have arthritis or just that they have kidney failure. It's that they have COPD and arthritis and kidney failure.
Right.
Very common in our rural communities.
So when you speak to legislators and you have those discussions, is it about money?
Certainly money is a major factor. Again, you can't keep the doors open if people aren't going to be able to pay. But some of it is just, regulation changes. things that we can do that won't necessarily cost any money, but that'll make life easier for folks. Currently with our pandemic situation, we have a lot more going on via telehealth.
Right.
Telehealth, some of the changes that need to happen are strictly lines on a piece of paper. That they don't cost the taxpayer a dime. One of the things that we're working with is our rural health clinics. They, in a normal situation, they get caught in a bind where they can provide telehealth to their patients via a specialist in an urban community, but they can't provide telehealth to a patient who's at home and be able to provide service to them without them actually driving into town to have the appointment. Currently, because of the pandemic, they've got a waiver to be able to provide that service remotely. But once the pandemic ends, are they going to have to go back to only providing service to an urban specialist or through an urban specialist? I don't know. And if we don't get that regulation change fixed, they're not going to be able to continue to do that. And it would be much better for the clinic, for the patient, for the taxpayer, for them to be able to provide those services on that level.
Yeah. I'm glad you brought up the pandemic and telehealth. I was going to ask you, what's your take on what you're hearing from different providers about the transition to telehealth? How's that going?
Yeah, so, anytime you want changes, it's nice to have changes all planned out in advance, but we didn't exactly have that. So people are doing what they can. It's interesting. One of the barriers always has been that, people don't, I will say that rural providers are not change agents. They're not typically on the forefront of, we want to try something new, partially because something new tends to be expensive. And if they can't get reimbursed through Medicare or through insurance providers, they're not going to do it. Now all of a sudden they are turning over backwards to try to make anything they can work for their patients and their community. They care, very deeply about the people that they serve. So they're scrambling, trying to put together telehealth programs as fast as they can. If, of course, they have broadband, because you don't have telehealth without broadband. And in our rural communities, broadband is not consistent.
Yes. Although it does, if you do have that connectivity, it does address the decades-long albatross that's hung over this area in transportation.
Yes. Yeah, it's been interesting. I was interviewing someone who's providing support groups online now because she can't do them in person. And she said that her no-show rate for her support groups has almost bottomed out because no one has an excuse of, well, I can't get there. Which has always been a major barrier in our rural communities, is there is no subway from wherever to wherever.
Yeah. No trams from Floyd to Parisburg.
No, not today. Not today.
And we're seeing the same thing at New River Valley Community Services. I mean, we're seeing a pretty drastic drop in our no-show rates, which is a good thing. People are getting help. They're getting access to care and doing what they should be doing to take care of themselves. Let's talk about the impact of the opioid crisis.
Oh my, yes. Yeah, so, it's been very interesting. The Virginia Rural Health Association has been fortunate to pull down, several grants to address the opioid crisis. But the reason why we've been so fortunate is that our numbers are so stark. Whether we're looking at, opioids or meth or any other substance abuse, the combinations that we have in our rural communities of the push for prescriptions for a variety of reasons, the job loss, the lack of other types of services. Again, back to there's not a lot of specialists. There's no, the lack of pain management clinics, the lack of alternative things such as exercise facilities or yoga centers or whatever else. All those came together in a pretty nasty combination to really hurt our rural communities. And it's been very difficult. We've been working for the last year with the state rural health associations in West Virginia, Pennsylvania, Kentucky, and Tennessee to try to build together a regional response to the opioid crisis. Because, as we know, things don't stop at the borders in Appalachia, right. And we need a very much a regional approach to the problem.
What about the mental health side of things? What do you see from your perspective?
Well, so, you've got a combination of things with mental health. Again, there's not a whole lot of providers. Very few behavioral health specialists, licensed clinical social workers, peer counselors, anything like that are hard to find. But you've also got the issue that the stigma in terms of mental health is much deeper in our rural communities. People are told to, cover it up and keep it quiet and whatever else. You certainly don't want your pickup seen out in front of the shrink's office, now, right. Do you?
Right, exactly.
And so it's, again, compounding the problem where it's not just one issue, it's multiple issues.
Well, we've been pretty heavy on the negative side of things, but there's a lot of great things about rural Virginia. So what are some of our assets in this part of the world?
Absolutely. Well, we certainly have, when it's not this hot out, the beauty of nature. If you want to go hiking or biking or canoeing or kayaking or rock climbing or whitewater rafting, we've got all of that. Photography, you name it. It's a beautiful place to live. The people are wonderful. There's a lot of things when you get into healthcare. People talk about social supports. We've absolutely got that in our rural communities. People will look out for each other and take care of each other. Minding your own business is not necessarily something we're strong at, but that also means that the people are there for each other. The other thing with our rural communities that we're trying to really capitalize on, we talk about the lack of providers and how hard it is to recruit the providers to our communities. If you can get people to realize, number one, that the benefits of small town life and the lack of hustle and bustle and the beauty of nature, but also your student loan has a different level of impact in small town America than it does in the DC suburbs. And when you're trying to pay the rent, you can get the big house on the hill in our small rural communities, and you're not going to get that in the Chicago suburbs. So we've got a lot going on in terms of being able to entice people here once they fall in love with it. It's a great place to be and to live and to work.
Yeah, I am proud to call this area home. Couldn't imagine being anywhere else. I mentioned in the introduction that you've been in your position for about 15 years now.
It will be 15 years in October. Go figure.
Well, congratulations on your upcoming anniversary, work anniversary. But I was wondering, just from that perspective, and being in this position for so many years, what have you gained from this experience?
Oh my! So it's been interesting. One of the benefits of being with the Virginia Rural Health Association is we're an affiliate of the National Rural Health Association, and to be able to work with their staff and learn from them on how to engage elected officials to really make change happen has been fabulous. The connections I've got now with congressional staffers where I can just pick up the phone and say, hey, it's Beth, and they know who it is. It's been a wonderful experience. They've been great to work with. I have a chance to be able to learn about rural health issues, all over the country, because obviously, what we see in rural Virginia is very different in the Plain States or in Alaska. But there's a lot of things that we can look at and borrow ideas and be able to adapt other programs. So it's been fabulous.
Yeah. So some common denominators, I guess, as far as challenges that other states are faced with, just like Virginia.
Absolutely. Recruitment is recruitment, no matter where you live. Right. You got to send people on the community.
Yeah. You have an event coming up. We're recording this the day before you have an event coming up with Senator Tim Kaine. Can you talk a little bit about that and what that's all about?
Sure. So Senator Kaine's staff reached out to me because he has proposed some legislation, specifically the Mothers and Newborn Success Act, looking at the issue of our maternal death rates and infant death rates, specifically in the African American communities and other minority communities. One of the things that we know is that, for a woman of color, she is 2 to 3 more times likely to die in childbirth than white women. And so to be able to address that, it is his goal, and we are very much happy to support him on that. We know that in Virginia, the maternal death rates for our African American communities, especially in our rural areas, is very dire, and that absolutely has to come to the forefront.
Do we have ideas about what to attribute that to?
There's a spectrum of things. Like everything else, it's not just one thing, but certainly, unfortunately, racism is a public health issue, and we can absolutely point to data that says that people are not treated equity because of the color of their skin. Women are less likely to be believed by their doctors when they say, something's wrong, I'm in pain. Less likely to be given the medications they need to stay healthy, a variety of issues like that. So, part of this, I don't know exactly all of the details of what he's proposing, but education of our healthcare providers has got to be part of that.
Absolutely. It's unfortunate that's a factor, but that is reality, I suppose. Beth, are there any resources for our listeners that you might point to around knowledge of addressing rural health needs?
Sure. So it actually, of course, I got to plug the Virginia Rural Health Association, encourage people to be members of VRHA, and you can just go to vrha.org and puzzle the stuff out there. Would definitely encourage people, one, to look into the National Rural Health Association, all of their resources. If you're specifically interested in mental health issues, there's the National Association of Rural Mental Health is a great resource. But also, if you're just looking for rural health information in general, whether you need data, whether you're looking for grant opportunities, anything like that, I would absolutely look into the Rural Health Information Hub. They have a massive library of resources on anything that has to do with rural issues, in particular with rural health. And if you don't see what you're looking for, call or email their staff and they will find it for you.
All right. Fantastic. I'll include links to all those in our show notes.
Fabulous.
Well, I'm not going to let you get away without sharing some parting words of wisdom. So, you have anything you'd like to say to our listeners or food for thought to pass along?
Oh, mercy. You know what? Go rural. That's all I got.
Works for me. Works for me. Yeah. Well, Beth, thank you so much for taking time to be on the show. Really enjoyed our conversation, and hopefully we'll find an excuse to get back together and do this again soon.
Thank you, sir.
All right. Take care. Dissect and Connect is sponsored by Teen Connections, a leadership program through Planned Parenthood South Atlantic that empowers youth with the facts about sexual health and the skills to build stronger, healthier relationships. It's free, totally virtual, and you can earn $100 when you graduate as a Teen Connections peer educator in your community. Join a Teen Connections program from home today. For more information, be sure to check out the show notes from today's episode. We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners, or New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.